Hello, I'd like to welcome so many of you for joining, and thank you for joining us today. My name is Mark James. I'm the CEO of Prompt Maternity Foundation, and I'd like to welcome you to our first live webinar. And this has been introduced to launch the new annual update package. We recognise it's been a challenging year for everyone, not just those working in maternity units and health service, obviously more recently as well for those food board supporters too. We hope to bring you a bit of cheer today and give you more information on the package and encourage you to download it. Whilst we've been able to maintain our normal training this year, I've been really proud of the team, and I hope many of you took advantage of the e-learning package to allow COVID compliant education to continue. But that was then, and we're moving forward now to face-to-face, and so we've spent the rest of the year developing updates for the future. Prompt multi-professional training needs to be able to react to new guidance and safety alerts, which we have seen being produced at regular intervals this year. So we're now moving to a model of releasing an annual update, and this is to ensure that the training remains current, relevant and fresh. So there is an opportunity for you to submit questions today using the Q&A. We will address that with a panel at the end. We're also recording the webinar, so this will be available on the website for maybe your colleagues or other units who are unable to join us at the minute. So I'm delighted to welcome some of the Prompt team, old and new, to give us a flavour of the contents of the annual package. So I'm going to start by introducing Tim Draycott and Kathy Winter, obstetrician and midwives, who I think need a little introduction. So Tim and Kathy.
Welcome everyone, and absolutely delighted to be presenting the Prompt Annual Update 2021. As Mark has said, we moved to an annual package to try and keep things as fresh as possible, really building on the foundation of the e-learning package we made last year. In fact, a lot of people have fed back, haven't they, Kathy, saying, yeah, they really like the narrated presentations, they like some of the really useful bits about the remote package. So what we try to do is build on that and take us forward into this year, where hopefully we're back face-to-face training, doing what we all want to do. So I'm going to talk about, as you know, I'm the sort of big picture person in the team, Kathy, and you're the detail person.
Okay.
So thanks very much. And Kathy, what are we going to be doing in detail this year?
Okay, so talking about what's in our package this time, of course, Prompt has traditionally been called Course in a Box, and it is actually physically in a box this time. It's in a cardboard box, so no plastic here, but we've managed to keep all of the facilitation tools and the guidance within one package. We're focusing on 6 key modules this year. If there's anything that we're not covering, then obviously we've got the e-learning package, which has got additional information as well. One of the new modules is Impacted Fetal Head, and Katie's going to share a bit more information about that with you shortly. We've also got a new drill facilitation video and some top tips, and hopefully that's going to be enough information to support the teams as they run their drills locally. Neil and Sharon are going to share a bit more information about that too. And then, as is the way with Prompt, we've got plenty of posters, proformas, linear algorithms we've included this time, all to make the right way the easy way. That's always our little motto, isn't it?
And I think on top of that, we've got a supplementary reading book where what we try to do is condense and summarise a lot of the national reports, recent guidelines, and really try to update and summarise any interesting evidence and new research coming in the future for impacted fetal head, as you just said, for postpartum hemorrhage, for maternal sepsis, breech birth. I think there's a big study ongoing with that, isn't there? Severe hypertension and teamwork in human factors, kind of what's new.
Yeah, and of course we've still got the Prompt course manual. But the idea of the supplementary reading booklet is obviously it's covering evidence that's come out since we published the course manual.
An update of kind of where we're up to.
Absolutely.
And we'll also put some example programs in, so as templates for you, in your unit to make a bespoke local prompt day that's perfect for you. So really looking forward to everyone getting back into the training. And Kathy, we put something exciting at the end, haven't we?
Oh yes, so we've got our yoga videos.
Wow.
Just little short 5-minute yoga videos, which you can use during your day. It's just a way of being interactive with your teams, and some of them are sitting down, some of them are standing up, so there's a bit for everybody.
I'm doing the sitting down ones. Thank you very much, and we're really looking forward to working with you all this year, so thank you and welcome.
Tim and Kathy, thank you very much for that brief introduction. I'd like to introduce Sharon Atwell next. She's one of our obstetricians, and she's going to give you some details on how you might be able to access and download the materials for the package.
Thank you, Mark. We listened to feedback given about difficulties downloading our e-learning package in hospital trusts. So, new for our annual update, we're delighted to introduce an online learning management system which should make this easier. As you can see from this example, when you receive your package, you'll get a code which will enable you to access this online system. You'll then be able to download and access all the materials to be able to use them in your own unit. More details about how to use this new system will be provided when we sign up to the package. Now back to you, Mark.
Sharon, thank you very much for that, and we hope you find this a much easier way to obtain the information than previously. Next, I'd like to introduce Katie Cornthwaite, one of our obstetricians as well, who's going to give you some more detail in what's really new in the modules.
Thanks, Mark. We are really delighted to share with you a selection of updated modules in this prompt package. Each module has a PowerPoint presentation. We've provided a narrated version, as these were very popular in the e-learning package. But as usual with prompt, we've included a standard PowerPoint for you to adapt locally. We are very aware that one of the challenges in running drills is managing the practicalities, such as the burdensome paperwork or not having information for the facilitation of the drills, which is tailored to that scenario. So in this package, we are introducing a scenario booklet for each of the modules that will take you through running a local drill in your unit. And the really exciting thing is that there is no more laminating, because the scenario module booklet provides everything you need for your facilitators to run the drill. It includes an equipment checklist, instructions for the patient actor, handover, facilitation guide, key learning points, and all of the clinical and team working checklists for the observers. We have even thrown in some prompt pens. There is something new in every module, and some things that you might be doing for the first time in prompt training. For many of you, this will be your first introduction to pre-hospital prompt, and we have also included a brand new talk on cardiac disease in pregnancy and our first ever module on impacted fetal head at caesarean section. Back to you, Mark.
Katie, thanks for that. I hope you'll agree that there's a lot of exciting new material for the future. Katie will be coming back later to talk more detail on the module on impacted fetal head, which is obviously quite current and in the news at the minute still. I would like to welcome Neil next, one of our anaesthetists, and he is going to cover team working and some of the new resources we have to help those units that are struggling to train their facilitators.
Thanks, Mark. So I'm just going to run through some of the resources in the new package for dealing with team working and to help with facilitation. Now, as you'd expect from prompt, team working is still threaded throughout the course. So the presentations, workshops, and of course the drills all have teamwork elements threaded through them. We've also included a teamwork presentation. We've taken it out of the introductory talk, so now you'll have a standalone presentation covering teamworking and human factors. Human factors have always been a key part of prompt. However, some of the feedback we've received from you says that it needs to be signposted a little more clearly. So we're pleased that by devoting a whole lecture to team working and human factors, that those plugs in the perceived gaps have been plugged. However, as we point out in the new presentation, teaching teamwork training in isolation, whilst very popular, may not be as effective at helping improve outcomes. So we still encourage incorporating team working into the clinical scenarios, which the evidence does support. So a big part of that come in the drills, and we know that many of you have struggled to train up new faculty to run them. So in this package, we've included new resources to help you train up your teams. We've put together 2 videos for facilitators, one which runs through much of the guidance we would normally cover on our Train the Trainers days, such as setting up the scenario, briefing the team, how to actually run the scenario as a facilitator, troubleshooting common problems, and how to run a debrief at the end of your drills. We've also included a short video with our top tips for facilitators, gleaned from the frequently asked questions on our training days. We're confident that these resources will be plenty for the majority of units. However, for teams new to Prompt or who are keen for a bit of extra support, we are still running virtual Train the Trainers programs, and Mark will talk about that a bit later towards the end of this webinar. Thank you, and back to you, Mark.
Neil, thank you for that. We know that this was something units were asking for, and we're confident that this will address it. I'd like to welcome Sharon back now, and she's going to just talk about our new module on pre-hospital prompt. And this is a whole resource of material to try to encourage maternity units to collaborate with ambulance crews and paramedics in managing maternity issues in the community.
So thank you, Mark. So I'm briefly going to talk about pre-hospital prompts. So why have we developed this course? This course has been developed because national bodies have always recommended pre-hospital staff training for maternity care, and they've said that this should be multi-professional and it should cover pre-birth, birth and post-birth care. It should be practical with hands-on training for emergencies and supervised by local midwives and doctors. So we developed this course in conjunction with South West Ambulance Foundation Trust, and it's been going on for about 5 years now. We're delighted to provide this course now as part of our annual update. So we designed it to bring maternity units and ambulance trusts together for training, and we recommend that it's run by midwives, obstetricians and local paramedic trainers. The presentations that we provide cover pre-birth, birth and post-birth, for example, hemorrhage in pregnancy, gynecological bleeding, normal birth and maternal collapse. And all of these presentations can be adapted to local maternity and ambulance trust guidelines. We have developed specific algorithms which are in line with JR, and we've provided, as part of the package, 2 sample algorithm booklets. Ambulance trusts can then order copies for the paramedics themselves directly from Prompt. We have some scenarios which are specifically designed for pre-hospital maternity care, and it enables hands-on experience in the pre-hospital management of maternity presentations. With the COVID-19 pandemic, we have adapted the training to be also run over virtual platforms such as Microsoft Teams or Zoom, and we have filmed interactive video simulations which could be used in place of hands-on scenarios. Thank you. Back to you, Mark.
Sharon, thanks very much for that. I hope you all find it a really useful resource. We've already had several ambulance trusts contacting us to inquire about how they can set up training and collaborate with local units. Next, I'd like to go back to Katie, who's going to provide you with more detailed information on what we see as quite an important module on impacted fetal head. And that's because the NHS resolution recently has raised it as an area of concern.
Thanks, Mark. We are thrilled to introduce our new module on impacted fetal head at caesarean section. Impacted fetal head is increasingly becoming recognised as a critical obstetric emergency, sometimes associated with potentially devastating complications. And I'm sure many of you will have encountered an impacted fetal head clinically and be familiar with the associated challenges. However, there's no national guidance or training on how to manage it and minimise these risks. And until lately, impacted fetal head has also been considered to be a problem solely for the obstetrician. However, it really is a team emergency, and everyone in theatre has a role to play, from the anaesthetist providing support and narration to the woman and their partner and being prepared for the possible risk of postpartum hemorrhage, to the maternity care assistants who may need to help optimise the woman's position for a vaginal push-up or escalate to seniors. And we have surveyed both obstetricians and midwives, and we know that you need and want more. The new impacted fetal head module includes the latest research with evidence-based lessons for management for the whole multi-professional team. We've included data that challenge some of the current thinking surrounding this emergency, highlighting the heterogeneity of the condition and showing that this is not simply a problem of caesarean section at full cervical dilatation. And we've put together a master algorithm outlining a stepwise approach for management. We recognise that there are still uncertainties about the superiority of one technique over another, but we also know that no one technique is universally successful, nor is there a single panacea. We want to provide you with accessible guidance to support your management and technique selection, and crucially, show you how techniques can be performed safely and effectively. We've included additional algorithms for specific techniques used to disimpact the fetal head, detailing for the first time how basic hand manoeuvres can be employed to assist disimpaction, as well as detailed guidance for a vaginal push-up and reverse breech extraction. We have also included some videos demonstrating how these techniques are performed in simulation, which we really hope you will find useful. And of course, it's not just about how to perform disimpaction techniques, but also the non-technical skills, the decision-making and human factor issues. We really hope that you'll enjoy this module and find it useful for your practice. Thank you.
I hope you enjoyed that. I think the team did a fantastic job. I think it's very professional and it contains a lot of update and useful information. It's been a difficult year for us, so we normally do a lot of face-to-face training, and lockdown has not allowed us to do that. And whilst we're easing restrictions in the future, we see it as a foundation that, in fact, I don't think we'll be able to travel nationally, or nationally groups of obstetricians and midwives need us to be traveling to us. It's just too risky. So we've spent the time developing a virtual T3 course, which we're very excited about. We're going to be using Microsoft Teams for that, and that's been limited by the fact that that's what most units will be able to use. We're going to develop a worksheet for units so that they know exactly the equipment facilities that they'll be required in order to make it as realistic and live as possible. We hope to produce that later this week, so we know there are some units already booked into T3, and we'll be able to let them know as soon as possible, but also those that may want to do it in the future. The benefit of the virtual T3 is to encourage units that maybe have not performed the training in the past to get them involved, but also for units that need updating. And the benefit of doing it within your own unit, it saves on travel and also allows you to train as many people as possible. So we'll be releasing more information on that very soon. So thanks for joining us, and thank you for questions that have been submitted. So I'd like to go to the panel discussion. I'm delighted to welcome Tim Draycott, Kathy Winter and Neil Mutachuta. And first question came in, and this is actually from a lead training midwife who was saying that they don't perform prompt training, but we're keen to get started and use the annual package. What advice can you give them?
Yeah, okay. So, I guess if your unit hasn't done at all, then there's some guidance that we're supplying with the package. But I would say it might be worth signing up for the virtual trainers program.
Because I would say that you're going to get a lot more information then around how your team can integrate the drills and the hands-on training in their unit. If you've done prompt before, and maybe you came to train the trainers for prompt 3, then certainly I hope all of the things that we're providing this time, we've got the video PowerPoints, we've got also some webinars that we'll be doing at certain stages as we go through. As more and more teams sign up, we'll focus on key themes that the teams are asking us to cover in the webinars. So we're hoping that there's enough information there that you might feel that you don't need your trainers program at the moment.
I think one of the other things that people have often asked about is help with facilitation, and as you've seen from that little snippet there, that we've got this facilitation video that is there to help you get extra people on your faculty trained up and how to deliver the training. And so I think that will be a real benefit as well.
Yeah.
Yeah, thanks for that. Another question was probably close to most of our heart is that have you any advice on how units might go to raise some funding in order to pay for the training package?
So thanks, Mark. I think there are a number of I think Prompt is consistent with a number of the most recent recommendations for training. So it's consistent with the recommendation in Ockenden, consistent with the recommendations in the maternity incentivization scheme. And I think it's useful for units to have a think about, okay, how can they work with their own trust boards to ensure that the savings, et cetera, are directed to the maternity department to invest in this kind of training, going forward. But I think it is consistent with all the current recommendations, and we're hoping that people should be able to work with their own trust to free up some funding, as I said, to invest in staff, to invest in our teams, to do the best we can,
Thank you. One of the questions comes through in what support is Prompt going to be offering to training units, whether if they're struggling to download the training material or even use it.
Neil, do you want to kick that one off?
So this has been a feature, I think, particularly with IT systems in the NHS, we know that office has been quite difficult.
Yeah.
So hence our move to this LMS, the learning management system. I really think that will iron out a lot of the difficulties that people have had. Obviously, we're delighted with the success of the interim virtual package, but some of the feedback that we've had was they were handling large files and so forth. So with some of the NHS firewalls, that's been tricky. I think the LMS will iron out a lot of those details. So when you sign up the package, and we'll be giving you extra information about how to make best use of that LMS, and I think that will smooth over the process considerably.
And we're still offering email support
for units absolutely.
Who are struggling to download things.
Yeah.
I think we're really keen to if people really are struggling, particularly with as you said, Neil, some of the bigger files, etc. Although we put them in one place, I think that's we're definitely keen to support where we can. I mean, Kathy.
And we're producing the webinars as well, aren't we?
Yeah.
So again, if we get some key themes coming over that maybe teams are struggling with, then we'll produce a webinar that we can put on the website. We can release to the teams that are invested in the Prompt package, and hopefully that will be the key to sort of keeping you up to date as we go along with the package.
So we're going to try and be responsive, aren't we?
Yeah.
If people
absolutely.
do email in with questions, then let us try and block those up in wee chunks, and we can try and address them in webinars.
Yeah.
Of course, for those units that do feel that they need that extra additional level of support, as Mark said, there is the train the trainers. So the first ones, I think, are already booked up in September and October, but there'll be some more dates being released soon. And so you'll be able to sign up for those as well through the website.
Yeah.
Great.
Okay, we've a questions come through about can staff do the T3 course on their own or as part of a team?
I would reply to that straight away and say I think the value is going to be doing it as part of your team. So the joy, I suppose, of the virtual thing is that your team haven't got to travel to us. Whereas we used to do just the 4 multi-professional trainers, and then you had to go back to your unit and actually share it with the rest of the trainers.
Sure.
Now you can actually do it virtually, as long as you've got a room that you can socially distance enough, etc. in, then you can have all of your trainers attending. And whilst on one hand it seems easy for having isolated trainers joining in, what we're going to aim for, and it's the trainers is over a day and a half, we're hoping that the team spirit that we've definitely generated when we do the trainers day, we can still do with your local teams in your units. So I would say,
I think there's 2 things there, aren't there?
Is to have the team together.
I just wanted to say 2 things. I think for the trainers, definitely worth doing it as a group, because I think it's one of those things where you can kind of talk about it as you kind of talk through it. Okay, how are we going to do everything else? However, I think when we have produced webinars and narrated presentations, then that definitely might be worth going through by yourself.
Yeah.
Just to update yourself. Make sure it's all okay.
Yeah, and I think one of the other benefits of having the virtual system in terms of the trainers is being able to have more of your team training at the same time. So up until with our standards, coming to see us, 4 people have generally been able to come from the unit. And of course, then the responsibility is really on you to go back and deliver extra training back to the unit. So it kind of doubles the effort. Whereas here, you'll all be able to take part as a team, as many facilitators and so forth, and team members as you feel that you need.
So we can try and flex that a bit.
Yeah. And I think the aim of the trainers as well is that, as we go through the day and a half, you'll learn together all of the resources, because there's, we've had that feedback that we do provide a lot of resources, and then you struggle to find things. But hopefully, again, with the LMS as well, which is where you're going to be downloading them from, we give you a good long access to that. So it's not like you've got to have 2 weeks and you download it. You can actually have one person has longer access, which means that you can download the resources in bite-sized chunks, really.
There's another question as well, maybe pertains a little bit to the learning. Have you any advice you can offer people about mixing the virtual and the real life simulation training?
Well, I actually think that's possibly going to be, the way we're going to go. I mean, like everything else in life, once COVID came along, we did tend to have to do everything remotely. And I think we'd all agree that some of that has worked and not all of it's worked. So possibly with the training, I can definitely see advantages to maybe doing some of the lectures and things on Teams, and then integrate your hands-on drills perhaps for, half the day.
I mean, certainly some of the feedback we had from the interim training was that units quite valued the narrated presentations, because I think a lot of people don't like giving the presentation sometimes. And actually people sometimes want to see an expert like you, Kathy, give the presentation. And I think my own view is it kind of mix and match what works for you. And that might be different on different days, depending on staff, as well as different years,
Absolutely.
And also having it in a kind of hybrid model, and certainly with the narrated presentations, I think one of the advantages is that it cuts down on your requirements for extra faculty. So we know that it can be quite difficult to get, trying to get different professional people coming in and delivering the lectures. So that with all of the presentations in this package have all got narrated presentations going with them. So that's an advantage. But of course, we recognise that it's really important as much as possible to localise it at your own unit level. So if you want to go out and deliver your own narrated presentations, all the better.
And get your local information into the content. And I don't know if you saw in the video, we were talking about the little 5-minute yoga clips as well. Now, again, I think there's some, value in if you're going to utilise those, maybe the team together, you get that bit of team working going, even with the yoga. But I guess if you're doing it on your own, still got to do it on your own.
Okay.
That's fantastic. One last question, actually. This is from me. When are they going to get it?
Okay.
Thanks, Mark. I'm going to defer that to Kathy straight away.
That's a very good question. I think the key thing is those units that have already signed up for it, our admin team are going to be contacting those teams straight away to find out where we can send the kit to. And we would say that will probably be in the next week or two that you'll be hearing from us and getting the package. Those units that haven't signed up yet, then go to our website, send an email to our inquiry address, and then we can start the ball rolling with getting your orders for the package or for the virtual trainers.
Great.
Anything else to add?
No, I think that's all covered.
Okay, thanks very much, panel. I hope that's answered some of your questions. I hope you're encouraged and as enthusiastic as I am about this package, and look forward to hearing from you. So if you want information on the package and how to download it, just go to the Prompt website and click on the annual update. We look forward to hearing from you, and we obviously are offering an early bird discount as well from this. So I hope you enjoy this, and thank you very much for joining us.